Welcome back to AfyaWingu Patient Management. In this video, we'll walk you through Section 4, History and Safety, where you'll capture the patient's full medical background, including allergies, current medications, past conditions, and key safety details like last meal and bowel movement. You're still viewing the record for Maxwell Wright, age 20, male, with visit date November 25th, 2025. We've already documented his chief complaint, vital signs, and history of present illness. Now it's time to complete his full clinical picture with important background and safety info. At the top of the screen, you'll see the tabs again. We're now on 4, History and Safety, which is highlighted in blue. Let's go field by field, with clear examples for each. Section D, Medical History and Safety. This section helps you identify risk factors, potential complications, and safety concerns before treatment begins. 1. No known allergies, NKA. This checkbox is checked by default, meaning the system assumes the patient has no known allergies unless you say otherwise. If the patient does have allergies, uncheck this box and then use the fields below to list them clearly. Example, if the NKA checkbox is uncheck, then fill in. Drug allergies. Penicillin causes rash and swelling. Food allergies, peanuts, causes throat tightness and difficulty breathing. Tip, always ask, do you have any allergies to medicines, foods, or materials? Never assume. 2. Drug allergies. If the patient has drug allergies, list them here, including the reaction they experienced. Example, sulfa drugs, rash, ibuprofen, stomach pain and nausea, codeine, dizziness and vomiting. Format tip, write clearly, include drug name or class. Reaction, e.g. rash, swelling, vomiting, anaphylaxis. Tip, press the Add button after each entry to add the entries at the bottom of the input section. This keeps the list organized and easy to read. 3. Food allergies. List any food allergies the patient has, including the reaction. Example, dairy, diarrhea and bloating. Eggs, hives and itching. Shellfish, swelling of lips and tongue. Format tip, include food item, reaction, e.g. diarrhea, hives, anaphylaxis. Tip, don't forget common allergens like peanuts, tree nuts, seafood, soy, wheat, and milk, especially if the patient is being prepared for surgery or IV fluids. 4. Medications. Press Enter after every medication entry. List all current medications the patient is taking, including dosages and frequency. Example input, lisinopril 10 mg once daily orally, paracetamol 500 mg every 6 hours as needed, metformin 500 mg twice daily. Format tip, write clearly, include drug name, dose, e.g. 10 mg, frequency, e.g. once daily, twice week route, e.g. orally, IV, topical. Tip, press Enter after each medication to create a new line. This helps keep the list clean and readable. 5. Past medical history. Select all that apply. Check any boxes that match the patient's history. Available options: diabetes, hypertension, asthma, heart disease, kidney disease, cancer, past surgeries, HIV, other. Example, if Maxwell has asthma, check asthma. If he had an appendectomy last year, check past surgeries, and optionally note it in the other field or in the medications box. Common combinations: hypertension, heart disease, diabetes, kidney disease, asthma, allergies. Tip, don't guess. Ask the patient or check their past records. If unsure, leave unchecked and flag for the doctor. 6. Last oral intake. Ask, when did you last eat or drink anything? Example, ate 2 hours ago. Other examples, nothing since midnight, sipped water 1 hour ago. Last meal, 8 a.m. today. Why this matters: critical for procedures, surgeries, or if sedation is needed, helps prevent aspiration. 7. Last urination, bowel movement. Ask, when did you last pee or have a bowel movement? Example, last urination 6 hours ago. Last bowel movement, yesterday morning. Other examples, pee 3 hours ago, BM, none for 2 days. Pee just now, BM this morning. Why this matters: helps assess hydration, kidney function, and gastrointestinal health, especially important in abdominal pain, fever, or elderly patients. Save your work. At the bottom left, click the blue Save Information button after entering each field, or at least after completing the whole section. The system auto-saves, but clicking Save ensures everything is recorded and visible to the next clinician. You'll also see last saved November 25th, 2025, updated by Malaika Center. This helps track who entered what, important for accountability and continuity of care. And that's it for Section 4, History and Safety. Once you've completed this, you're ready to move to Section 5, Assessments, to document your clinical impression, diagnosis, and plan. Section 6. Administer medications to prescribe or give drugs during triage. Each step builds a complete clinical picture, helping doctors make faster, more accurate decisions and keeping your patients safe. Thank you for using AfyaWingu, making medical history and safety checks simple, structured, and life-saving.